Hello and good day, everyone. My name is Darlena Birch, MBA, RDN, and most importantly, public health dietitian. Welcome to my YouTube channel, where I discuss U.S. federal nutrition programs, the important role they play in ensuring the health and well-being of all Americans, and how public health dietitians work tirelessly to support these amazing programs. All views expressed on this channel are my own and do not represent the opinions of any entity whatsoever with which I have been, am now, or will be affiliated. In today's video, I'm going to talk about the health disparities surrounding food allergies. When you think of food allergies, you probably think of an upper middle income individual or family, and when you think of where people with food allergies shop, you probably think of Whole Foods or those incredibly expensive gluten-free pizzas that you see at your local grocery store. Even if you don't have a food allergy, I think most of us can recognize that living with a food allergy is anything but cheap and affordable, because allergy-friendly alternatives for everyday foods are typically expensive. Did you know that food allergic individuals spend 5% more than the average consumer on their groceries? These consumers face challenges finding the food they need and end up visiting multiple stores and stocking up on safe, tasty, and affordable foods. The truth is that food allergies don't discriminate. The truth is that anyone, regardless of race or socioeconomic status, can have a food allergy, and families of means are better equipped to accommodate food allergy. This is why I'm dedicating today's episode to the disparities surrounding food allergies. But first, let's define what a food allergy is. Food allergy, which I'll interchangeably reference as FA, is a serious and potentially life-threatening medical condition affecting 32 million Americans. 1 in every 13 kids has a food allergy, and every 3 minutes, a food allergy reaction sends someone to the emergency room. An increasing health concern worldwide, 8% of U.S. children have a parent-reported FA, and recent studies have found that as much as 10.8% of U.S. adults have a self-reported FA. Put simply, a food allergy is a medical condition in which exposure to a food triggers a harmful immune response. This immune response is called an allergic reaction and takes place because the body's immune system attacks the proteins in a food that are normally harmless. The protein that triggers this reaction is what is called an allergen. Symptoms of an allergic reaction range from mild, such as itchy mouth, abdominal pain, or a few hives, to severe reactions such as throat tightening and difficulty breathing. If you've ever heard of the term anaphylaxis or anaphylactic shock, then it's important to understand that this is a severe allergic reaction that can result in death within seconds or minutes of being exposed to a food allergen. In the US, the 8 most common food allergies are milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. These 8 foods account for 90% of all FAs in the US. While these are the 8 most common FAs, however, it's important to understand that allergic reactions can happen in response to any food, and some people are allergic to multiple foods. Another thing I want you to understand about FAs is that they're potentially life-threatening and should always be taken seriously. Do not dismiss people who live with FAs as dramatic, lying, or overreacting. The onset of FAs can actually happen at any point in time in life, in both childhood and adulthood. Currently, there is no cure for food allergy. So you may be wondering right now, Darlena, it sounds like a small segment of the US population is impacted by FAs, so why should I care? You should care because understanding the economic impact of food allergies is imperative in guiding public health policy. And the fact is that FAs are an injustice that significantly impacts low-income Americans. As Dr. Martin Luther King stated in 1963, "Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. Never again can we afford to live with the narrow, provincial, outside agitator idea. Anyone who lives inside the United States can never be considered an outsider anywhere within its bounds." So now I'm going to go over some fast facts regarding food allergies. A 2013 study found that food allergies cost about $25 billion each year, which totals to about $4,184 per child per year. The study estimated that the yearly direct medical costs due to FAs was at about $4.3 billion or $724 per child. This includes hospitalizations at $1.9 billion, outpatient visits to allergists at $819 million, emergency room visits at $764 million, and pediatrician visits at $543 million. Out-of-pocket costs for caregivers of children with FAs was at $5.5 billion or $931 per child. This included costs of diets and allergen-free foods at $1.7 billion, changes in childcare at $857 million, and changes in schools at $650 million. Yearly lost labor when caregivers took their child to medical visits was at $773 million, or at $130 per child. This included allergist visits at $318 million, pediatrician visits at 165 million, and emergency room visits at 148 million. Based on the study, yearly job opportunity costs were at about $14 billion or $2,339 per child, including losing their job, fewer job choices, and giving up jobs or changing jobs. In April 2019, Kids with Food Allergies, a division of the Asthma and Allergy Foundation of America, conducted the My Kid's Life with Food Allergy survey. Surveying 1,234 parents of children with food allergies, the survey captured more information about the full impact of FAs on families' lives, including the economic burden of managing this chronic disease. The initial summary of the data shows that food allergies trigger significant financial stress on families. 44% of parents had to make a career change to take care of their child with FAs. 29% said they spent 15 or more hours per week managing their child's FAs, and 18% had incurred debt because of FAs. Needless to say, the burden of food allergies on both individuals, families, and society are large. So now I'm going to dive deeper into the health disparities surrounding food allergies. In Food Allergy Research and Education's Blueprint for Access Equity, published last February, recent research demonstrating that Black Americans are significantly more likely than white Americans to develop food allergies is cited. Furthermore, the report states that Black and Latino children are at higher risk of adverse health outcomes for food allergy compared to their white counterparts. Costs incurred for food allergy-related emergency department visits and hospitalizations are 2.5 times greater for low-income children than higher-income children. These increased hospital care costs for low-income children are likely attributable to difficulties in accessing epinephrine and safe, affordable food. Moreover, Black FA families and FA families in the lowest income brackets spend much less on specialist visits compared to those in higher income brackets. Now, this might sound positive at surface level until you consider that when access to specialty care is limited by financial barriers and time constraints, increased spending on emergency medical care and poor health outcomes for families is the result. The barriers preventing minority and low-income community members from accessing specialty care also impacts the rate of diagnosis. Recent research suggests that rates of official diagnosis of FA are 87% lower among a Medicaid population compared to the general population. Moreover, living with an undiagnosed FA increases the likelihood of accidental ingestion. Additionally, discrepancies in diagnosis may disproportionately affect Black and Latino Americans, as they are around 2 times more likely than white Americans to be covered by Medicaid. Additionally, Black Americans and Hispanic Americans are 8% and 22% more likely, respectively, than whites to not have any health insurance. I don't know about you, but for me, these facts are startling because the truth is that affordable access to specialty care, medications, and allergen-free foods are critical to keep all food allergenic children and adults safe, regardless of income and race. So what can you and I do to help ensure equitable access to the available tools and resources for individuals and families living with FAs? Advocate. I always close out my episodes reminding you that you are your own best advocate. So if you have a food allergy, advocate. Contact your legislators and educate them on the impact that FAs have on your daily life. And even if you don't have an FA, you can still advocate for those in your community who do. As Americans, we have the right to communicate with our legislators and elevate issues of importance. If we don't make our legislators aware of the importance that ensuring equitable access to FA resources has, then we cannot truly create change in public policy to tackle this important issue. Additionally, knowledge is power. Understanding the latest guidance on introducing complementary foods to an infant's diet is an important step in reducing the incidence of FA for future generations. It was once recommended that parents delay introducing infants to foods that are considered allergens. However, in 2019, the American Academy of Pediatrics concluded that there is no evidence that delaying the introduction of allergenic foods, including peanuts, eggs, and fish, beyond 4 to 6 months prevents FAs. In fact, specific to peanut allergies, evidence shows that early introduction of peanuts may actually prevent peanut allergy. Lastly, I want to provide some resources for those individuals and families living with food allergies. The first resource I want to highlight is the Food Equality Initiative. FEI improves health and ends hunger in individuals diagnosed with food allergies and celiac disease through access, education, and advocacy. FEI has a variety of resources, including webinars and the 7% Fund and Coalition, which brings key stakeholders together to close the gap regarding economic and racial disparities on FA through strategic partnerships with industry and community partners. The second resource I want to share is from Food Allergy Research and Education. FAIR has a number of useful resources available in both English and Spanish for people who have FAs. They also provide FA resources for staff who work for food assistance programs. Now I want to highlight a couple of food assistance programs. The Special Supplemental Nutrition Program for Women, Infants, and Children, aka WIC, is a program you guys heard me highlight multiple times because I think it's a great and amazing program. As I've shared before, WIC is the nation's premier public health nutrition program, serving over 6 million income-qualified women, infants, and children up until their 5th birthday. In WIC, participants are issued food benefits that are purchased at approved grocery stores. Food benefits include items such as vegetables, fruit, eggs, milk, bread, and cheese, and WIC programs across the nation adjust the foods that participants receive to accommodate food allergy. The next program I'm going to highlight is the Special Nutrition Assistance Program, abbreviated SNAP, but more popularly known as food stamps. SNAP provides benefits to eligible low-income individuals and families using an electronic benefits transfer card, which is similar to a debit card. Purchases are made at grocery stores, and eligible foods include fruits and vegetables, meat, poultry and fish, dairy products, breads and cereals, snacks, and non-alcoholic beverages, as well as seeds and plants that provide household food. The last resource I'm going to share today is Kids with Food Allergies. Kids with Food Allergies has a nifty webpage that lists patient assistance programs for epinephrine for those individuals and families who struggle to afford it. Thank you for joining me today. If you like what you see, please smash the like button and subscribe to my YouTube channel. And remember, you are your own best advocate. Feed your body well, nourish your soul, nurture your mind, and nutrify your spirit. Remain true to yourself and never forget that every step forward is another opportunity to be a better version of your past self.